Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare.
Hello, everybody, and welcome to our next episode of Boombostic Health in the Wild. I'm here with Maitham Dib from Junction.
Yes.
Great to have you here. So this guy came all the way from London to try to fix our healthcare system. I don't know if the NHS was already too messed up, but in any event, love to have you here. Thanks for joining.
Thanks for having me. It's excited. Yeah, came all the way from Junction, from London. Sorry. US healthcare system. Very passionate about fixing it, and we have similar issues in London too.
Yeah. No, I hear you. I've had experience on both sides of the pond. So as I shared with you when we were first catching up here, I've been in this diagnostic lab world for quite a while, and I believe that lab is the most underappreciated element of healthcare delivery. It's considered this point in time thing. It's a place in the basement of the hospital that's less than 5% of the budget. So there hasn't been as much innovation, but what's happening with this whole emergence of data and insights that can come, especially when you leverage AI, is this understanding that there's so much insight that can be gleaned from all this lab information, but you can't glean it if the lab tests aren't happening.
100%. We have similar views on this, and I'm a big believer that it's like I said, 70% of medical decisions all rely on lab testing.
That stat. People use that stat everywhere, and it's so true. It might even be higher than that. Nobody can actually say where is that stat from, but it's got to be true. And the other one is 70 to 80% of the content in a medical record is lab derived, both clinical and pathology and everything else. So, it's huge. Huge.
We're a big believer that, not 100%, why can't we get that up to 90% of medical decisions actually rely on lab data or some sort of diagnostic, right? Whether it's imaging, etc. But a big problem that we're seeing is, especially as care is moving from in clinic and in hospital to at home and virtual care, patients are not getting, it's not personalized to where they live. They're not getting all the follow-up communication. So they end up actually not going to the lab, right? And that's a huge issue because typically in clinic settings, 70% of lab orders get fulfilled. Virtual care, that drops sometimes to 30%.
So 70% of the lab orders, when it's a telemedicine kind of lab order, or when you say external?
Traditionally, in clinic and
in clinic, 70% gets fulfilled. When you say out of clinic, what does that mean?
It's virtual care, telemedicine.
Yeah, telemedicine. Okay.
Yeah,
so those folks, 70% of them, so only 3 out of 10 actually ever get the actual lab test run.
Correct. And that's a huge issue because now you're seeing, third less patients.
Right. And how is Junction addressing this issue?
Yeah, so a big believer of software can actually tackle this problem, right? And so we focus on how do we build a personalized white label solution that any company can use to deploy lab testing across all 50 states in a scalable fashion. And we focus on having the best sort of scheduling experience, being able to tailor whether you...
So a consumer-friendly approach.
We are trying to consumerize lab testing.
Bring the Amazon style to lab testing.
Even Amazon, you've probably seen the Function Health, you've probably seen Superpower, all of these newer lab testing companies come up. And how do you provide that experience? But to everyone in healthcare, right? It's not that tech savvy, right? How do we make that turnkey? And that's sort of what we're focused on.
So what's an example of a customer that would be looking to white label lab testing?
We have actually a variety of customers. Today, typically we sell into sort of the Parsley Health of the world, found sort of a lot of digital point solutions. So they either focus on weight management, fertility, and they have some sort of telehealth practice, and that's who we typically sell to today. But we're seeing increasing direct primary care is really getting involved in sort of a lot of labs. So they want a better experience because they're seeing all of these customers going to more consumerized lab testing platforms, and ultimately they're losing revenue, right? That's sort of a big issue for the direct primary care, and then also primary care too. What we're seeing is they're going to do these lab tests that have 100 biomarkers on there. And then they come into these primary care clinics and they tell the doctor, what does this mean, right?
Right.
So a big part today is we help patients actually get the lab tests done, but we also want to help with the result delivery part as well. How do we help physicians ultimately actually interpret all these results too? And that's another part of the platform that we're building out as well.
Okay, cool. So when did you start the company?
We started about 4 years ago.
Okay.
So started 4 years ago.
And what were you doing before then?
I was working at a telemedicine company called Babylon Health. So I don't know Babylon, but one of the biggest issues they had, they were sort of one of the first movers in the telemedicine space back in 2016, 17, and none of the infrastructure existed to do lab testing. So they had to go integrate with LabCorp Quest directly. They had to then integrate with test kits and test kit providers. There was no at-home phlebotomy, or it was very sparse. They couldn't scale it across all 50 states. And that's where the idea of Junction came from. How do we make it easier for anyone in healthcare to build? And for us, like the most important part of healthcare right now is diagnostics, because it's the first entry point. So how do we make that seamless?
And I assume you don't own a lab.
We don't own a lab. We think labs do like great work. You've got LabCorp Quest, you've got Sonic, you've got a bunch of others that do some awesome work. So we just work with the labs and have close partnerships with them.
Okay. So when you do a deal with a specific provider, like you use fertility as an example, there's a certain type of test that needs to be performed.
Yeah.
Are they coming to you and saying, hey, we use this lab, but we don't have enough people converting when we try to get them to do the test? So then you're adding this experience that's specific to that diagnostic test, but it's with the lab that they selected? Or do you have labs that you bring, or is it both?
It's kind of both. So what we see is typically they may have already an existing lab contract, and they have an EMR integration. It's a bit of a black box. You just order via the EMR and that's it. And sometimes what we see is clinical admin, like the clinical admin team are actually calling the patients, trying to get them to go to the lab.
Right.
And you're like, this is not scalable. Like it's a lot of work, right? And so a big part of what we do is we say, okay, you can still order through the EMR. We have a lot of EMR integrations that people can use, and they can order through our interface. And that still goes to their LabCorp or Quest BioReference accounts. But then you get all the added software benefits. So you get all the sort of automated SMS communication that we provide, emails, phone calls. And then we have a white label scheduling experience that you can brand under your fertility clinic that lets patients schedule at a specific location. And it actually tailors we find, for example, if someone lives more than 30 miles out from a PSC location, the drop-off rate is huge.
Okay.
Right. So in those cases, what we'll say is maybe we should use at-home phlebotomy. Yes, it's more costly, but you're actually going to get the patient to convert.
Right.
It's a further opportunity for care downstream. Right. So that's what you need when it comes to telehealth and virtual care. You really need to tailor your approach when it comes to diagnostics. You can't just expect people to drive always to the PSC.
So sometimes is it actually some type of a custom kit that you're consulting on and saying, hey, we need to do it this way in order to make it so that people convert more and make it so you can deliver the kits to their home and they can self-collect?
Yeah, correct. So we support 3 modalities. So you can either do, or 4 modalities. You can do on-site collection. You can do sending someone to a PSC, a patient service center, test kit, or an at-home phlebotomy. And what we say is actually through our white label platform, you can actually tailor it to the patient. So depending on if that patient is far away from PSC, we may suggest in the sort of UX, actually you should do an at-home phlebotomy appointment.
Okay.
So we'll actually increase your conversion.
So when I hear all of this, it harkens back to the portal world. Every lab has a portal, and every integration of the EHR is a huge pain in the ass. And it feels like you're bringing something much different than a portal. Could you talk to where is the software actually? I understand the logistical part of routing and trying to do the follow-up. There's almost like a campaign management, it seems like, where you're helping to convert the patient to actually get the test done. So that requires some type of follow-up and follow-through and all of that coordination.
Yeah.
What are the boundaries around what you're doing, and where is software really part of that?
It's in all of it, really. So first of all, just the direct integrations with the labs, that's all software, right? The next bit is all the outreach and campaign management. That's all software, but it's all personalized dependent on a model we've built, right? So we have a lot of data on lab testing. We do about 3.4 million lab tests annually today. And, that's growing a lot, essentially, with diagnostics exploding currently. So we use all that data to build proprietary models to understand what are the key things that affect conversion or utilization of lab tests. And based on that, so that's all software, essentially. That's all rules that we've built. Sometimes we use machine learning. And based on that, we'll sort of build a model and use that to sort of predict what's the best method to use for a patient.
Okay. When you look forward, what's the vision for this? What do you envision Junction's world looking like, I don't know, a decade down the road?
It's a great question. I think we're seeing, we've seen ChatGPT, Open Evidence, all of these companies aid physicians with sort of note summarization and just general like level of care, navigation, things like that. I think healthcare infrastructure needs to exist, right? It's always going to be here. And for us, it's like, how do you build a great patient experience across all the different areas of healthcare infrastructure so that, if I look 10 years down the line, I think doctors will be sort of focused on more of the less of the routine stuff, and they rely on these like agents and all the AI stuff. But that AI needs to sort of communicate with infrastructure, right? And that's kind of where we're going to sit. And we're looking at what are the other parts of diagnostics infrastructure, right? Soft tissue imaging is another area. We may expand into, and that's like another part of the diagnostic chain that we want to support and build a great patient experience for.
So would a telemedicine primary care type of a provider, that be a good partner for you?
Yeah.
Okay. That seems like it would. Yeah. We had a CEO of HealthTap on yesterday, and HealthTap's a very highly regarded telemedicine platform. They've got some really interesting things going on. Lilly Direct, for example, just partnered with them to be their exclusive provider. And it's interesting because typically the pharma companies had been targeting some specific companion diagnostic to get their drug dispensed, but that's becoming a bit outmoded and being replaced by, hey, if you're going to engage with patients, you need to do it comprehensively. So all of a sudden, this is another door that diagnostics is entering into, where there's another point of distribution and access to patients. And it sounds like you fit into those kinds of scenarios as well.
Yeah. So anyone that's got some sort of like telehealth offering, like we would fit directly into, because we can actually increase the patients you're going to see because we can get those lab tests fulfilled, right? So we do sell into a lot of telehealth platforms already. But yeah, that's an exact type of.
Sounds like a cool innovation, makes sense, but it always comes down to one big question: who pays for this? Who's going to pay for it, right? In healthcare, there are all kinds of amazing ideas, and all too often, nobody wants to pay for them. Talk to me a bit about the business model.
Sure. So typically we're B2B. So we sell into the other businesses, and they typically pay for like a platform fee. So a monthly fee for access to our platform. And then for every order that gets fulfilled, so actually successfully gets fulfilled, the patient goes to the lab, we charge like a fixed usage fee. So it's like a single dollar essentially for every successful lab. So that's typically how we bill. And then if it's depending on if it's cash pay or insurance, we have like different billing models. Obviously, if it's cash pay, often what happens is we never sort of take margin on lab tests or anything like that. Whatever sort of the lab charges either the client or us, we forward that on to our clients, and we still just make our fixed fee. If it's insurance, obviously the third party billing, so it just goes through. The lab is billing the insurer, and we're not involved in that process.
Okay. So you're not getting reimbursed.
We're not getting reimbursed.
Yeah, you're a new cost that gets introduced into the model. And I'm talking this through because this is what I always hear from providers, like, how does this work? So for a specialty clinic doing fertility or there's like hymns and those kinds of services. Like there are now a whole bunch of these. I think hers is a thing too. If you're that kind of an outfit, you're making money from people subscribing to have these recurring fills of whatever the meds are, right?
Yeah.
So if you're more of a conventional provider, though, who's getting paid fee for service, is that probably not a great place to land right now because they're not willing to have any additional costs? Or
no, it's a great place to land actually.
Okay.
It's the way we see it, like, would you not pay $1 to get that patient actually come back into your office so that you can bill them for other follow-on care?
Okay, so because if you don't do the diagnostic, you don't identify the gap that exists, and
Exactly.
if you don't identify the gap that exists, you don't have any care to give. And by the way, that patient's going to end up somebody else with some other doctor getting diagnosed later when they have some type of catastrophic thing happen. So people use the term leakage. There's like a keepage aspect to the
a huge keepage aspect, right?
Okay.
And like you've also got like the Hims and Hers and all these other companies vying for that patient's attention as well, right? So you as a doctor should be incentivized, like, how do I get this patient back in? Essentially,
Right.
they
What
need to
about
complete
functional medicine, like the longevity players? Like that's another area. I do a lot of functional medicine, and I have a pharmacist who just so happens to be my longtime business partner's wife, who is big into functional medicine, and she has these test kits sent to me, and she takes care of it all, but she's doing that because she really enjoys it, and it isn't scalable at all. So it sounds like this part of diagnostics and functional medicine might be a good fit as well.
That's actually where we started. So yeah, we had a lot of functional medicine longevity companies that actually use our platform today to do sort of cash pay testing. And it's actually a similar issue because if you're sort of one of these like digital health brands that do cash pay testing, you also want your patient to convert, right? When they're going online, you want to make sure they convert and actually do the lab test.
Absolutely. Yeah.
Right.
Yeah. That makes a ton of sense. And a lot of these folks are selling their supplements and things that are related to whatever the test result is.
Exactly. So like, it's so important they convert. So like, what we've done is we've taken all the learnings from all these like digital first brands and tried to bring it more into traditional healthcare. When we say like we want traditional healthcare to look like the Hims and Hers of the world and all these longevity companies, we want them to look just as attractive as all these other companies to this like really consumerized healthcare population, right?
Yeah, right.
And that's how you like impact healthcare in a huge way. I'm a big believer in all these like companies too, these longevity and digital healthcare companies.
Yeah.
But I think the challenge is how do you make traditional healthcare look more like, you know, the digital healthcare and all these like really like consumerized brands? How do you make healthcare look that?
For sure, yeah. So my very first company I ever started was an e-commerce company. Back when the web was initially spun, like in the mid 90s, and Netscape became a common way to access the internet. So anybody who could use the internet, even if you were technical, and that was a novel thing at the time. And I built this e-commerce company that was designed to be all around the customer. Then I ended up deciding to get a real job at my dad's suggestion, went to work for Ernst & Young doing tech consulting and healthcare, and was blown away by the fact that nothing was designed around the customer in healthcare. And in e-commerce, everything's designed around the customer. And that expectation now exists for convenience and access. So it makes a ton of sense to me. And diagnostics are such a big deal. Also, people don't really think about biometric tracking as a diagnostic, but it is.
It is.
What you're really doing is identifying all these different factors. But there's also now this awareness that lab testing needs to complement that in order to see the whole picture. Actually, Whoop, which I'm a Whoop band user for years since they basically got started. In fact, I've been wearing this thing for like 2,500 days straight or something. There's a little counter that tells you. But now they have a program that relates to having a diagnostic lab component. And that is also something that has a lot of regulatory implications. So it's an interesting world. We need another 20 minutes to get into that. But I think you're in a good position regardless of which way the puck goes on this, because we know diagnostic testing is critical. So, Maitham, I really appreciate you being on the Boombostic Health podcast.
Awesome. Well, thank you so much for having me. And yeah, we're excited about diagnostics. So
awesome. Yeah, we should talk about collaborating with HC1, which is in, 440 hospitals and health systems. And gosh, I don't know, we're handling hundreds of millions of lab values every month for the purpose of closing care gaps. But the more access people have to testing, the more efficient it is, the better. So look forward to exploring that too.
Likewise. Thanks.
Well, hey, everybody. Thanks for being here for another episode of Boombostic Health in the Wild at the Health 2025 Conference Diagnostic Zone. We'll see you next time.